Good morning. My name is Sheila from BMR Health and Wellbeing. I'm going to talk to you today about ISO45003 and looking at mental health in the workplace of psychological health and safety under the remit of occupational health. I do like these webinars to be as interactive as possible because there's nothing worse than death by PowerPoint. So do feel free to have your cameras off. Do feel free to jump in and ask questions as we go along, and there'll also be an opportunity for a Q&A at the end of the session, okay? Can I just quickly ask, who on the call has responsibility for mental health? Who works in HR, who works in health and safety roles? You could just give me an idea.
I'm HR.
HR, okay. Okay, and anybody else?
Hi, sorry, go ahead.
So it's Barry Loftus. I'm health and safety.
Okay, all right, excellent. And are you familiar with the new standard?
Not really, no. Hence why I'm coming on this call today.
Excellent. Okie dokie. All right, so we've got a mix of health and safety and HR people on the call, so that's brilliant. Okay, I'm just gonna. There's a few more people just coming in at the minute. Excellent. Okay, so we're going to get started. So yeah, so today we are going to be talking about 45003. Now, in respect of the standard, what that's looking to do is to really put a framework in place around psychological health and safety in the workplace. Now, I work at BMR and we're basically an organisation that looks at taking a really systemic and data-driven approach to workplace well-being in guidance with this new ISO 45003 standard. It's all about having this psychological health, safety and well-being management system in place. Okay. So we've got quite a few things that we're going to be discussing today. Is this recording? Can we tell if this is recording? It is, isn't it? Yes, it is. Yeah, so what we are going to be looking at today is really, you know, what do we need to be doing as organisations? At the moment, we take a lot of approaches that are very tertiary when we're looking at mental health. And what I mean by that is we're looking only at dealing with mental health in the workplace when we've already got an identified problem. So we're using mental health first aiders, we're using EAP programs, but something's already gone horribly wrong by the time we get to the point that we're having to use those interventions. So really what we need to be doing is taking it a step back and to stop those issues from happening in the first place. So we can't magic away workplace stress and employee stress by focusing on fixing the employees, because the employees are not the problem. The problem is the workplace, okay? Stress is just a symptom of what's going on in the work environment, be that workload, be that lack of support, or the way that work's being done, a really bad IT system. All of these things can cause stress. So it's the workplace that we need to be looking at, not the individual, okay? So in terms of today's discussion points, we're going to be looking at the statutory legal requirements that exist around workplace mental health, because there are many. I see a lot of the time on LinkedIn, on the news, requests for mental health first aid to be made a legal requirement. That is not going to solve anything, okay? There is lots of legislation in the UK to protect employees, to protect employee health, and to put real consequences in place for businesses who fail to meet these legal requirements. I'm going to talk about the size of the problem, give you some stats around kind of how big an issue this really is, and how COVID has had an impact on that massively. And then we're going to look at really, so if we're going to do workplace wellbeing, how do we do that? What is an integrated approach to wellbeing? How do I make sure I'm covering all of the different areas? And that's where we come on to 45003. And we'll talk about what psychological hazards are, and how we can look to measure our return on investment when it comes to our workplace wellbeing programs. So just to touch on the legal framework in the UK, okay? So we've got the Health and Safety at Work Act 1974, okay? The Health and Safety at Work Act is absolute in law. This is what you have to do. And as an employer, okay, you need to make sure, so far as reasonably practicable, the health, safety and welfare of all employees, and that extends to psychiatric care, psychiatric illness, psychological health. That's covered in health and it's covered under welfare. So you have to look after your employees, okay? Then you've got the health and safety regulations at work, and that again is law, and the law says how you need to do it. Okay, so Regulation 3, Regulation 5 requires employers to carry out risk assessments, to give information and training and resources and competency to employees, and that is psychological as well as physical safety, okay? And then we've got things like the stress management standards from the UK Health and Safety Executive. They're best practice guides, okay? So, you know, if you're going to do it, you're going to be looking after, you're going to be fulfilling your duty of care by carrying out risk assessments. This is what you'll be looking at. This is where the stress management standards, and this is where ISO45003 come into play, to really give you this granular detail and this framework for making sure that you've got all of the specifics in place. And I don't know how many of you on the call are also familiar with things like the Thriving at Work standards. All of these are things that have been published over the recent years. They're all brought together under stress management standards, ISO 45003. It's nothing new, okay? It already exists, it's all there. So just to put that into context, you know, these are not the only areas of law that cover psychological health, okay? We've also got the Equality Act, we've also got Protection from Harassment Act, we've got the Corporate Homicide Act 2007, and more and more and more now, as cases are going into courts, investigators and prosecutors, since the rollout of the ISO 45001 occupational health framework, when things are getting to court, prosecutors and investigators are asking board directors the extent to which they have or have not followed the guidance in the standard. Now, the standard isn't, okay? Thomas, would you mind putting yourself on mute, please? If everyone could just check that you're all on mute, that'd be great. So, yeah, the standard's not law, but it's best guidance. So when employers find themselves sat in front of a judge in a corporate homicide, and I'm talking absolute extreme far end of the scale here, you know, they will be asked potentially, what guidance have they followed, okay? So, and that's in terms of 45001 for physical safety, but how long is it going to be given COVID and the state of global mental health before, you know, the same questions are being asked to 45003, okay? And I just want to make the emphasis, risk assessments are required by law. No risk assessment, no excuses. I did not know I needed to do it is not defensible in law, okay? It's absolute duty of care and an absolute requirement to do it, okay? And there's plenty of case law that exists around that, okay? I've cited 4 cases here. Walker v Northumberland was a social worker who had a really heavy and emotional caseload. Yeah, and he suffered a mental breakdown. And then upon his return to work, their employer did nothing to assist him, made no changes to his work at all, despite requested assistance. He had a second breakdown and then was dismissed because of his ill health. And that case really established a precedent that it was the employer's duty to provide a safe system of work. It extended to psychiatric illness. The employer was in breach of that. And, you know, the second psychiatric injury was a definite breach caused by a definite illness caused by that breach. So, and there are other case laws out there. So Barber v Somerset, Majewski versus St Thomas's NHS Trust. You know, these other case laws set the precedent around the Protection from Harassment Act. So this is where in the Majewski versus St Thomas NHS, an employer was held liable for damages under Section 3 of the 97 Act for bullying by one of its employees. Okay, so the manager bullying an employee, the employer was held accountable for it. Okay, and the same again in Helen Green versus Deutsche Bank. Helen Green was awarded £800,000, okay, under the vicarious liability, and she was then awarded another £35,000, okay, for psychiatric injury. So, you know, the case law is absolute. The law is there, it exists, and I think we'll see it being enforced more and more, okay? Does anybody have any questions so far? No? Okay. Okay, so if we move on to talk about the size of the problem in the UK is huge, okay, and it's getting bigger. So the cost of mental ill health in the UK is estimated at around 42 to 45 billion pounds each year. And if you look at the graph on the side there, that's made up of 6.8 of absence costs, so direct costs that we can actually calculate. It's made up of 8.6 billion of turnover costs. And then the other one that's a bit more tricky to do is this presenteeism cost. People turning up to work when they'd have been better off taking a day off because their head wasn't in the right space, or they are not in the right space. 26 to 29 billion is a conservative estimate in terms of presenteeism. Who on the call has had those days, or many days, or one-off days, or a week where you're turning up to work but you're just not doing anything? You're not involved, you're not there, you've got other stuff going on in your life, and you're not being your normal, efficient, productive self. That's presenteeism, okay? And it's estimated that that costs about £1,700 per year per person, okay, per employee. And if you look at that in terms of the financial sectors and the banking sectors, that doubles, that goes up to £3,400. The £1,700 typical public sector and private sector employees. And mental health is, you know, I think there's 264 million people globally diagnosed with depression, okay? It's one of the biggest burdens of ill health globally, okay? And to put that into context, if we look at the suicide numbers, yes, last year when COVID first kicked off in March, between the period of March to December, there were 1.3 million deaths, okay, from COVID, there or thereabouts. I don't know that I've got that exactly right, okay? But in that same period, and I say same period, from January to December 2020, there were over 1 million deaths by suicide, the highest it's been. And in the UK, that averages out at around 18 people a day, with 75% of them being men and 25% of them being women. And the scary thing is that, you know, I think suicide is the second highest cause of death in men in the middle age bracket. It's actually increasing now in the younger generation. So, you know, this is a real problem, and people are turning up to work every day. When people come into work, it would be fair of them to expect that they will leave feeling as mentally well as when they arrived in the morning. If they're leaving feeling drained, wrung out, and not as well as they were previously, then we've got a problem, okay? And if you want to look at it in further detail, you know, these are the numbers from the Health and Safety Executive, the period ending March 2019. There were 602,000 people off with stress, okay? 12.8 million working days lost. Then you go fast forward to last March when these numbers were published, 828,000 people off, up massively, okay? Absolutely massively. 17.9 million days lost, the highest it's ever been pre-COVID, okay, pre-COVID. And the problem is that within the workplace, we're teaching people to cope. We're teaching or trying to teach people how to be more resilient to stress, and it's the wrong approach. We need to be looking at the workplace and the factors that are causing stress in the first instance. Because workplace mental health is often started this way. We'll have the MHFA, we have the EAP, exercise classes, yoga, bananas, wellness apps. Brilliant, all really, really good initiatives, but they're not enough by any stretch of the imagination. These are all what we call tertiary interventions. It's when the damage is done. It's injury management, okay? So, and actually none of that is a legal requirement. The risk assessments that I was talking about earlier are. So what we need to do, if we want to get workplace well-being done for a continually improving workplace, so we're continuously looking at having this safe and healthy environment where everybody thrives and flourishes, we really need to take an extended approach that looks at addressing this design of work and not just the people. So to kind of put that into context, yeah, in a real simple example, we wouldn't tell somebody who worked packing boxes to go to the gym to be able to lift heavier boxes, okay? What we would do is we'd have guidance, we'd have rules, we would have training, we would have competencies around ensuring that we've got safe working practices to prevent injuries. So we'll do manual handling courses, we'll do lifting techniques, okay? So why, when it comes to mental health, do we think it's okay to just tell people to be more resilient to the levels of stress? Why are we not trying to understand what in the work environment is causing the stress? And then we get to work on that in consultation with the employees that are stressed to get that aspect of work more, less stressful. Okay, so in order to do that, what we really need to do is to start looking at this integrated model of workplace mental health. And this Canadian standard on psychological health and safety gives kind of two main things that employers need to be doing. We need to be promoting psychological well-being, okay? And we need to be actively working to prevent harm. Those are the two things we need to be doing, okay? And if you look on the chart, promoting psychological well-being is here, preventing harm is here, mitigating illness is the last thing we want to be having to do. And at the moment, it's the only thing that we're doing in our mental health, workplace mental health approaches. So, you know, if any of you have done any mental health first aid training or any mental health awareness training, you would be aware of the mental health continuum. And the continuum, you know, that's not a direct representation, it's like a concertina. For every individual in your workplace, they will have a different version of what that looks like, okay? But people in your business will either be flourishing really well mentally, optimal well-being in terms of mental health. For me, the physical health equivalent of that is that's like being triathlon ready, but from a mental health perspective, yeah? Most of us exist in the area of mental wellness. The kind of tricky area is when we kind of come into this term called languishing, where we're not 100% mentally well, we're not diagnosed with a mental illness, but we're in this place where we're just not okay at the moment, okay? And we'll go one of two ways. We'll either get ourselves mentally well again, or we might become ill and be diagnosed with a mental illness. The point is, everybody in your organisation would sit somewhere on that chart, okay? So when you're doing workplace mental health strategies, you can't just focus on this bit here, because we're missing out everybody here. So yes, we do some yoga, we do some exercise classes, brilliant, but who's going to do an exercise class? If you're stressed due to workload and you're sitting in here in languishing, are you really going to go grab a piece of fruit, go to do some yoga, feel better, move into here? It's not going to happen, okay? So what we need to do is to put activities in place and processes around these other bits, okay? So if we look at work design, let's look at how work is organised and make sure that it's done in the way that is optimal to cause the least amount of stress. Let's look at people's strengths. If we understand the strengths of the people in our work environment and we design work to cater for people's strengths, those people will be doing more of what they're naturally good at. They will create better results. There will be better relationships, okay? So looking at the flourishing areas, we can start to do that, but this work design is really, really key. And then what we need to be doing on a regular basis, not when there's a pandemic, not when somebody's gone off with, 4 people of one department went off on long-term sick. We need to be doing risk management and stress management and education across the organisation as part of our health and safety risk management, risk assessment processes. It has to be being done. And this is where the new ISO standard that's coming out next month, it'll be released mid to end of June. This is where the new ISO standard really kind of comes into play to give you that granular detail on how to put these frameworks in place. And this is no longer just a health and safety, just a HR approach. Okay, HR cannot do this in isolation. This is about the culture of your business. This is about the leaders in your business. This is about consulting with your employees. This is about HR, health and safety, quality management, all working together to create a safe and healthy workplace, okay? Now, this ISO is a voluntary standard. It's a child standard of 45001, which is an occupational health and safety management framework. And what this does is it sets out the agreed best practice that's been done across 74 countries, okay? Now, when the Health and Safety Executive Stress Management Standards first came into play in 2004, there was a massive reduction on the stress numbers in the workplace, okay? And that's because they were focused on the factors at work that contribute to stress and not the individuals. And that happened in 2004. And then for the last kind of 10 years, our approaches have slipped back to the approaches that we had back in the 90s on teaching people how to cope, okay? And guess what? The numbers have gone up because we've taken the safety systems away, we've taken the risk-based approach away, and we're just letting people become ill before we're doing anything about it. So ISO is the organisational process, and done properly, okay, it's not a silver bullet solution, it has to be done properly. It can be a real game changer. And we're taking this real blended approach with shared responsibility. It's not just down to the employer. Employee has a part to play as well. But we've got to then take this blended approach, looking at all of these primary, secondary and tertiary factors, and having the employer and the employee working together to prevent work-related psychological injury and ill health and actively promote well-being in this framework of health and safety, okay? And the key elements of ISO is to consult and to risk assess with leadership, really embracing it, okay? If leadership are not on board, your employees are going to know it's going to fall flat on its face. If your employees are engaged, if you're not getting the feedback from the employees, it's going to be really tricky to do. And if departments aren't working together and there's no cross-functional collaboration and support, again, it's going to be really, really difficult to do. So, this needs to be done as part of a cultural shift. It's a systemic process and it's a step-by-step process, okay? So when we're looking at risk assessments, we need to be able to identify hazards that exist. This is a standard risk assessment cycle, yeah? 4 steps. Identify the primary risk factors that, if left unchecked, yeah, could become a hazard. Know how to assess them. And then in consultation, you see the consultation on the outside there, in consultation with the employees that are giving you this feedback, you determine what changes can be made, and then you start to mitigate and control those risks by putting those changes in place. And then you need to go back and go, did it do the job? Was it effective? Okay, so I just want to kind of open up, if you just unmute yourselves and just ask, does anybody know, would anybody know what a psychological risk in the workplace would be? These are the things that contribute to making us feel happy at work or stressed at work. No?
Yeah, bullying, harassment.
Absolutely, Felicity. Yeah, absolutely. Anybody else?
Club culture.
Absolutely, culture. You know, I was talking to somebody the other day and he was saying about having a fish pond. And he kept putting his lovely healthy fish into this fish pond and his fish kept dying. And then he got a fish pond expert to come along who said that the water was toxic. And it really resonated with me because you can't put healthy fish into a toxic pond and expect them to thrive or even survive. So absolutely, you know, the culture is absolutely key. So some of the other factors that contribute, so psychological risk, the Health and Safety Stress Management Standards quote 6, we've got 8 here on the list, but these are basically the core principles of work that have a potential to become a hazard if not managed effectively, but they also have the potential to create really positive cultures and flourishing work environments. So we get workload right, we get autonomy right, we're very clear on our roles, we've got enough support, that, you know, bullying, harassment, relationship conflict is dealt with properly. We're recognised and rewarded for what we do, we consulted on change and the organisation's fair. So, you know, if you look at COVID, you know, we've had a lot of high demands put on us in terms of workload. We've had the feeling of being out of control, yeah, in terms of autonomy and how we're doing things. And then we've got this lack of support because we don't have our normal support systems around us with families, with work colleagues, etc. So everything is being blown up to another level. So these psychological risks and impacts are huge, and organisations are not assessing these risks systemically on a regular basis. So we work with another organisation and we use a digital platform, which is a tool that's been in development alongside the standard for the last 4 years. Now, this tool is not a wellness app. It's a diagnostics tool with built-in learning management systems and self-care kind of tools for employees. And the aim and the use of this is to enhance your current practices to consult and engage with your workforce, senior leaders and your managers. So it includes custom surveys, it includes risk assessment surveys around work design, cultural surveys. You can put surveys in with questions specific to your organisation. We have a live dashboard. We de-identify all of the data, so everything that's done is anonymous, but it's not a silver bullet solution. It goes far deeper in terms of workplace mental health. You know, workplace mental health needs leadership. It needs the framework. It needs consultation. It needs the tools to do the job. It needs the primary, secondary and tertiary interventions. This is a tool to enable you to do primary and secondary, okay? We have tertiary in most instances in place, okay? So this is just a tool that we use that supports you to work to the guidance laid out in 45003. So one of the key factors in there is about identifying the hazards. Workplace mental health is done most times with well-intended people wanting to do the right thing and coming up with stuff that sounds good. Let's do yoga, let's do boxing, let's do a gym membership. But is that what people want? What we need to do is to ask them, how do you feel about workload, about cognitive demand, about autonomy, role clarity, support from your employees? Let's ask them in an anonymous way and actually get the feedback. You know, we're not asking people what they want. And if we are, we're not doing it in a way that they feel comfortable being able to answer honestly. Okay, so we need to conduct these surveys to identify the hazard. This is the risk assessment piece. Okay, we're then looking at how do we assess that risk. So once people have responded, we have a live dashboard. It gives us the results as we go along. It scores it out of 100. Anything below 50, that's where we need to focus our efforts on. How do we focus our efforts on that? We talk to people. We get the results. We get people back. You said this in the survey. These were the results. What do we need to do to improve it? Through that consultation piece, the people doing the work know how they can do the work best. Listen to them. Take that information. If you'll have some short-term wins there that you can actually then start to put into a well-being management plan. Okay, 9 times out of 10 those will be around work, they'll be around training, they'll be around resource, it might be around different ways of doing work, but there will be a specific action with a specific person responsible, which would be timed and subject to review. So very smart objectives and actions when we're coming to our workplace well-being approaches. Okay, and then when we've done that, we need to go back and we need to ask the same questions again. And what we can do is we can go back, we resurvey the people, we get the results of the second survey. Did the factors that we intended to improve? If they didn't, we need to sit down and we need to go again. We still have a problem in this area. We need to fix it. Now, do you have the expertise in the organisation to fix it? It may be like you would when you're doing when you're doing a safety assessment. It may be that you kind of reach the limit of your expertise within your organisation in knowing how to fix a certain problem. So you bring in, I don't know, a specialist engineer to make a machine safe. In terms of workplace mental health, you may consult with an organisational psychologist to help you to get past these things. My point is you're identifying what it is you need to do to have the impact based on the information provided from your people. Okay, so we can go and then we constantly go again. How many times do we do this? Does it have to be onerous? It depends on your business. If you've got a bunch of problems, we probably need to be doing it more often. Okay, but once, maybe twice a year, this process needs to be going on. Okay, and it's all about what we call taking a Kaizen approach to workplace mental health. And what I mean by Kaizen is about developing a culture where everybody in the business feels actively engaged in having a contribution to and an input into improving the company. Yeah, so everybody's working together proactively to get these regular incremental improvements. Again, I think what we do with workplace mental health is we're looking for this magic bullet that's going to fix everybody. It doesn't exist. Yeah, we need to combine everybody's inputs regularly, you know, get employees involved, gather them a list of problems, get solutions and ideas, make sure it works, keep checking it, adopt it, repeat, and we go on and we go on and we go on again. Okay, so it can't just be for the few, it needs to be for the many. Okay, now again, what we then do is we can come on to measuring our organization's maturity of the well-being management system, and we measure against how the actions you have taken against the standards that and the actions that are defined within the 45003 standard. So you will score, you know, you'll start down and then you'll come and you'll start scoring as you go up the score factor here, and you'll mark off, do we understand the organisation of its context? Have we got leadership commitment? Do we have our policies done? Do we have organisational roles and responsibilities defined? Okay, and then as we go through that, our flourish factor, our organisational score can then be measured, because what's the point of doing something in a business if we can't measure it? We don't know if it's having any impact, yeah, positive or negative, because we need to measure it. So we can measure against the standard. And not only can we measure against the standard by scoring ourselves here, we can break it down by the different parts of the ISO element. And then as we go through each of the steps, the system each of the steps here are supported by what you need to do to meet that part of the standard, okay? And whether you've got 45001, whether you want to have a certified and audited process in place, or you just want to be working to the best in class, you don't have to be getting a 45003 certificate to work to the best, to work to the guidance, yeah? So, you know, we look at this example here, leadership and management commitment, a worker commitment, 5.1 of the ISO standard, develop a plan, demonstrate the commitment, all of the actions are there. So this is what we need to be doing. It takes you through step by step how you need to do this, okay? It's giving you the tools and the framework to actually get there, okay? So, you know, from an employer's perspective, you've got everything you need to put the structure and the framework in place. You've got the surveys, you've got the data analytics, you've got the guidance on 45003 and a step-by-step approach. You've got specific line manager training, okay, for line managers in your business to understand psychological health and safety. You've also got individual employee training for mental health awareness, sleep health, fatigue management. It's all in there, accessible not just to, you know, 5% of the workforce that have been trained as mental health first aiders, but for every single member of staff. And then, you know, on the employee side, there are also tools in there for employees to have access to stress reduction exercise, wellbeing check-ins, mood tracking and journaling, mental health education and digital coaching. So it pulls it all together, this fully integrated solution into one space with the framework of 45003, pulling that all together. And then what we're able to do is then really start to get into KPIs, yeah? We need KPIs for workplace mental health. These need to form part of our CSR policies, okay? And some KPIs that we can pull out straight away are things like intention to quit, things like how you're scored on your psychosocial safety climate, so how much the employees within your business perceive you care. We can measure burnout risk, stigma, okay? So these are all the cultural KPIs, okay? But they're measurable, okay? We can then look at the financial KPIs. So what's our current absenteeism rate this year? What was it 9 months down the line? Have we improved the total days lost to absenteeism? Yeah, has that reduced our costs? How long are people staying in our business? Do they leave very quickly? What's that saying about our culture? There's a cost associated with people leaving. Yeah, we can look at that in terms of what are we spending on recruitment? What are we spending on onboarding training? Yeah, and what is the attrition rate for employer-led resignations? Yeah, are we recruiting the wrong people? What's wrong with our recruitment process? When you look on a P&L or balance sheet for an organisation, often your staff costs could be up to 60–70% of your total spend, okay? Yet we don't break it down far enough to see of that staff cost, how much of it is absenteeism, how much of it is recruitment, how much of it is settlement agreements, how much is it in NDAs, how much is it in long-term sick, how much of it is short-term sick. These are really big indicators and really big financial reasons why employers need to do this, because they would save so much money, okay? So that's where I'm going to leave it for today, because I've got 20 minutes if we want to have a chat. Just put the cameras on and throw it out there for you to ask questions. So I'm going to stop sharing my screen and say, yeah, feel free to unmute and ask me anything you want.
Hi Sheila, it's Emma. I don't necessarily have any questions, but I just wanted to say thank you very much for that. It was really useful from my perspective.
Fantastic, brilliant, brilliant. Anybody else? Quiet today, everybody. Okay, no problem. Well, listen, if anybody wants to, there'll be a follow-up email with a link to the recording. If anybody wants to connect with me, you can connect with me on LinkedIn. If you want to also find out more about psychological health and safety, we've recently started a podcast with Peter Kelly from the UK Health and Safety Executive, and there we're talking to different industry, we're talking to different experts, be it industry leaders or health and safety specialists or corporate lawyers. We've got a whole bunch of different guests on there talking about psychological health and safety. So it's a really good source of information for you. There's the UK Psych Health and Safety.com, and then there is just the psychealthandsafety.com, which are our colleagues over in Australia. So do have a listen. There's loads of good content out there. And this is an area that, you know, is gathering momentum and it's growing quite significantly. So thanks for your time, and I hope to connect with you soon.